My name is Shawna Brown. I'm an attorney here at Mandelbaum Barrett in the Elder Law Practice Group. And today I'm going to be talking about some home health care alternatives to care in a facility. So many Americans today receive care in nursing homes or assisted living facilities, and often that's because they can't live safely at home anymore. However, there are some home health care options as an alternative to facility care. And I don't just mean having a home health aide 24/7. That's not necessary or appropriate for everyone, and some people can't afford that. But based on the level of care that you need, there are some programs available to help support some level of home care. So Medicare actually funds some programs that provide health services, and recent studies have actually found that a lot of Medicare recipients are underutilizing what they do offer. So Medicare Part A covers home health care for people following a hospital stay or a stay at a skilled nursing facility. So for example, if you have a surgery and then you come home, Medicare will cover some care to help you recover from your surgery. Medicare Part B covers some home health care services for people who just need some kind of skilled nursing care. You need to be considered homebound to get those services, and that could mean that you have trouble leaving home, meaning maybe you're in a wheelchair, your doctor recommends you stay at home, or leaving your residence requires a major amount of effort. So Medicare in those instances will cover some medically necessary part-time help or intermittent care. It doesn't pay for 24-hour nursing care around the clock or care that's only related to personal care. And what that means is things like helping you get dressed or helping you bathe. They don't cover specifically that kind of service on its own. So the Medicare Part B benefit is really meant to cover things like physical therapy, speech language services, or some intermittent skilled nursing care. So if you or a loved one may fit in the category of people who would benefit from this, it's important that when you're talking with the care agency that you understand exactly what Medicare is going to pay for and what they're not going to pay for, and that they provide you with that information in writing. It's also important to speak to your doctor to understand the types of services that you need. Medicaid also covers certain long-term care services and supports. They actually have a program in New Jersey called Managed Long-Term Services and Supports, and that provides comprehensive services in the community. So that does provide personal care services, such as helping you dress or bathe. And in order to qualify for the Medicaid covered programs, you do need to meet certain income and asset requirements, as well as clinical requirements. So you would need help with what they call certain activities of daily living. You would need help with 3 of those. So examples are things like eating, toileting, or getting dressed. And you can apply for that through your local county agency on aging, and it doesn't provide 24/7 care. So the Medicare and Medicaid benefits I've just discussed could be challenging because, what if your care doesn't show up, or what if you need a higher level of care? So it's not necessarily for everybody. And for some people, being in a facility may be ideal not only for, increased care, but also to provide more social opportunities. So it really depends on the person and what they need, but it's good to know that these services are available and that they are covered. So thank you for watching, and feel free to reach out to our Elder Law group if you have more questions.